Welcome to the Deep Dive. Today we're taking a close look at something pretty fundamental that's shifting in healthcare. It's about weaving equity and inclusion right into quality improvement, or QI.
That's right. And it's more than just, tweaking things that are already okay. It's really about making sure the best possible care actually reaches everyone, every single person.
Exactly. So we're going to unpack why this is becoming so vital. We'll look at practical strategies people are using and also the real-world impact it's having. Think of this as your quick guide, sort of a shortcut to understanding this really crucial area.
And for this deep dive, we've pulled from quite a few places. Discussions from things like the QI Playbook, articles focused specifically on equity and QI, and also insights from organizations like NABH and Supremedic.
Right. So our goal here, our mission, is pretty straightforward, isn't it?
It is. We want to understand how healthcare can actually provide fair, just care for all patients, no matter their background or circumstances.
Okay, let's dive in then. Quality improvement. It's not new. We've been at it for years. So why this intense focus on equity and inclusion right now? What's the piece we've been missing?
That really is the core question. Look, traditional QI, it aims to lift the overall standard, right? But this equity focus tackles a tough reality. The good stuff, the benefits of our healthcare system, they're not shared equally.
Not shared equally.
No. And when we talk equity in healthcare, we mean fairness. A system without discrimination, where everyone gets what they need when they need it. Simple as that, really.
But it's not just a nice idea, is it? The sources we looked at are clear. These unequal experiences, they're really baked into the system.
Oh, absolutely. The data shows it time and time again. Big disparities across all sorts of lines: income, race, ethnicity, gender, disability, even just where you happen to live.
Wow, so it's really pervasive.
It is. And these aren't small differences. They mean real problems. Less access to care, worse health outcomes, lower quality of life for whole segments of the population.
So even if we improve the average quality, if some groups are consistently left behind, then we haven't really solved the problem. Not fully. And that's precisely where putting inclusive practices into QI comes in. It's about making sure our improvements don't just work in general, but are actually designed to reach and help everyone in ways that make sense to them, culturally too.
Okay. So the goals are bigger than just general improvement.
Much bigger. Transformative, really. First, you want to actively take apart these health disparities, find the gaps, target them.
Identify and address.
Second, it's about building trust with all communities. When healthcare places actually show they care about inclusion, it builds bridges, helps communication. People feel more confident in the care. And interestingly, research shows focusing on equity actually lifts the quality for everyone. A rising tide effect, sort of.
Okay, this is fascinating. One of the sources, those equity, inclusion, and QI excerpts, brought up something, a bit uncomfortable. It said QI, if you're not careful, could actually make disparities worse. How does that happen? Yeah, that's a really critical point to grasp. Imagine a hospital rolls out a new online patient portal. Great for some, right? But what about people who aren't tech savvy or don't have reliable internet? That great QI initiative just created a new barrier for them.
Ah, I see. So it helps some but leaves others further behind.
Exactly. And that's why this idea of equity-focused QI or EFQI is so important. It's about being deliberate, making sure improvements intentionally benefit those who are often disadvantaged, not accidentally shut them out.
Okay, the why is crystal clear. Equity in QI isn't optional. So let's get practical. What can hospitals, clinics, healthcare organizations actually do to bake this in? What are the concrete steps?
Well, the absolute foundation mentioned everywhere is collecting and analyzing demographic data systematically.
Data.
Yes, but not just basic stuff. Really rich detail: race, ethnicity, income level or socioeconomic status, preferred language, disability status, insurance type. This information is crucial. It tells you where the disparities actually are, helps you focus your QI work, and lets you measure if you're making a real difference.
Makes sense. You can't fix what you can't measure or even see. So once you have that detailed data,
then you use it to inform equity-focused quality indicators. These are specific measures designed to shine a light on potential unfairness.
Like what? Give me an example.
Okay, so instead of just looking at overall patient satisfaction, you'd break it down. Are satisfaction scores different for, say, Black patients versus white patients? Or you could compare average wait times for appointments. Do people from lower income neighborhoods wait longer? Things like that. It pinpoints the problem areas.
Got it. That gives you a very clear map of where the inequities lie. What else? What other concrete actions?
Cultural competency training is huge. Really comprehensive training for all staff.
Why is that so key?
Because it helps providers understand different cultural values, communicate better, recognize their own unconscious biases. Basically, deliver care that's more personalized and effective for diverse patients.
And addressing bias is part of that.
A big part. Also crucial is promoting diverse leadership and decision-making. You need people with different backgrounds and experiences at the table when decisions about QI are made. Involving stakeholders from various communities ensures the policies and initiatives are actually inclusive and relevant.
So diversity isn't just about representation. It leads to better, more equitable design. What about the actual patient interaction?
That's where patient-centered care becomes even more critical. It means truly focusing on the individual, their needs, preferences, circumstances, and importantly, their social determinants of health. Things like housing, education, transport, these have a massive impact.
Right, the factors outside the clinic walls.
Exactly. And we mentioned addressing implicit bias, unconscious attitudes. Training is needed to help staff spot and counteract these biases in their clinical thinking. And finally, real community engagement. Not just surveys, but actually partnering with community reps to design and roll out QI work, making sure it's culturally appropriate and meets actual needs.
Our sources also mention specific frameworks, like a roadmap for this.
Yes, the equity-focused QI framework, or EQI, is a good example. It's quite systematic. Basically, it prompts you to put on an equity lens at every single stage of a QI project.
Every stage.
Yeah. So when defining the problem, you ask, who's most impacted? Who's not getting this service? When analyzing data, do outcomes change based on race, income, language? You keep asking those equity questions right through designing the fix, implementing it, measuring it, and sustaining it.
That sounds like a really practical way to ensure equity doesn't get forgotten along the way. Are there specific tools that fit into this?
Definitely. We talked about equity stratification of data, breaking it down by demographics. That's a core tool. Then there are things like community advisory boards, CABs, bringing people from marginalized groups right into the governance of QI.
Giving them a real voice.
A real voice, exactly. Health equity impact assessments, HEIAs, are another tool. They analyze how a new policy might affect equity, the risks and benefits. And practical stuff like culturally adapted patient materials, brochures, instructions in different languages, that builds trust.
What about technology?
Tech plays a role too. Mobile health and telemedicine can reach underserved areas, but you also need things like digital literacy training so people can actually use those tools. Bridging the digital divide is key for equity.
Okay, these are great strategies and tools. Let's make it even more real. The sources had some case studies, didn't they? Examples of where this has worked.
Yes, some really compelling ones. Take Hospital X. They focused on hypertension care disparities affecting their Black and Hispanic patients.
What did they do?
They used their electronic health record data to see the problem clearly. Then they brought in culturally specific education, language help, even set up blood pressure kiosks out in the community.
And the result?
A 15% drop in hypertension-related complications in just 1 year for those groups. Pretty significant.
Wow, that's a concrete impact. What's another good example?
Look at Clinic Y. They wanted to boost preventive screenings, mammograms, colorectal cancer screenings for their low-income patients. They saw the barriers were often costs in just getting there, so they introduced a sliding scale for fees, gave out transport vouchers, did targeted outreach.
And did it work?
It did. They saw a 25% jump in screening rates among those vulnerable patients. That saves lives.
It really shows how addressing those practical barriers makes a difference. Were there examples focusing on specific communities or conditions?
Absolutely. There was a mental health clinic that noticed immigrant communities were hesitant to seek help. So they brought in therapists who spoke the patient's languages, shared similar cultural backgrounds, and started peer support groups led by people from those communities.
And that helped.
Big time. Patient engagement went up, outcomes improved. It was about making the service culturally safe and relevant.
These aren't just U.S. examples either, right?
No, it's global. Think of Aravind Eye Care in India. Their model ensures patients who can't pay get the exact same quality eye surgery as paying patients. It's built into their system.
That's incredible.
Or Boston Medical Center tackling high maternal mortality rates among Black women. They use doulas, better pain management, bias training for staff. And in Africa, WHO programs in Uganda and Kenya used community health workers to bring HIV care out to rural areas, decentralizing care for better access.
Even university hospitals.
Yes. AIIMS Delhi in India has a rural outreach program. using mobile QI units for things like immunizations and antenatal care. Crucially, they track the impacts specifically by gender and cast embedding equity right into their metrics.
These examples really drive home that this can be done, and it works.
Let's zoom out again. What about the bigger picture organizations, policies? How do they drive this?
Well, there's definitely growing pressure. Accreditation bodies like NABH in India and JCI internationally are increasingly requiring equity assessments.
So it's becoming part of the standard expectation.
Yes, and NABH, being part of the Quality Council of India, sets important benchmarks. These bodies are also starting to look at social determinants of health in their quality measures. It's a shift towards seeing the whole picture.
So it's not just a nice to have anymore, it's becoming essential for accreditation.
Pretty much. And beyond rules, there's the ethical argument, isn't there? It's simply not just to have such wide variations in care. Plus, better equity means better overall population health. Everyone benefits.
Are there policies helping this along? Yeah, things like ESG and SDG frameworks push organizations. National quality goals, like we see in India targeting underserved areas, make a difference. And public health insurance helps reduce those financial barriers we talked about.
And inside the organizations themselves, does leadership matter?
Hugely. Inclusion in governance and leadership is vital. Diverse QI committees, co-designing projects with patients and communities, especially vulnerable ones, their perspective is invaluable.
You mentioned technology earlier. How might AI fit into this equity focus?
There's a lot of potential, though. We need to be careful. AI could help detect bias in healthcare algorithms. Geomapping can visualize disparities. Translation tools help communication. Digital tools for patient feedback, like prompts, can be tailored for diverse groups. And telemedicine equity dashboards could track if virtual care is reaching everyone fairly.
Fascinating potential there. So finally, bringing it all together, what are the kinds of measurable results we're actually seeing from all this effort?
We're starting to see real shifts, things like smaller gaps in C-section rates between private and public hospitals, better immunization coverage for kids in tribal areas thanks to targeted rural QI, more gender balance in access to surgery after specific campaigns focused on female patients, better diabetic control among low-income groups using chronic care models that are culturally sensitive.
Those are tangible improvements.
They are. They show that focusing QI efforts through an equity lens really does move the needle on health outcomes for people who were previously being left behind.
So the big takeaway here seems clear. Equity and inclusion aren't just, extras you bolt onto QI. They're fundamental.
Absolutely fundamental. You can't really claim to have a high-quality healthcare system if it's not equitable for everybody it's supposed to serve.
It demands moving beyond a one-size-fits-all mindset.
Precisely. It requires actively identifying and dismantling those systemic things that stop certain people from getting the care they need and, frankly, deserve.
Okay, so that leaves us, and you, our listener, with something to think about. Consider how these principles and strategies might apply beyond just healthcare. How could we use this kind of equity focus in other parts of society to build fairer systems? And maybe more personally, what's one small thing, one step you could take in your own world, your job, your community, to encourage a more equity-focused approach? Something to mull over.